Lipedema is a chronic and progressive medical condition that often goes undiagnosed or is mistaken for simple obesity. It is characterized by an abnormal accumulation of fat, primarily affecting the legs and sometimes the arms. Unlike typical weight gain, this fat distribution is distinct and disproportionate. Understanding lipedema is crucial for both patients and medical professionals. It is a specific disorder that requires a unique approach to diagnosis and management. While it rarely affects men, lipedema predominantly impacts women. Early diagnosis is vital for effective management and to prevent the condition from worsening over time. The hallmark of lipedema is its disproportionate fat distribution. Individuals with lipedema often have an upper body that appears relatively normal or slender. In stark contrast, their legs and or arms swell significantly with fat. This creates a noticeable difference in body shape. The fat accumulation in lipedema is typically symmetrical, affecting both limbs equally. This means both legs or both arms will show similar patterns of fat deposition. A distinguishing feature of lipedema is the sparing of the feet and hands. The abnormal fat stops abruptly at the ankles and wrists. This creates a characteristic cuffing effect, where the affected limbs appear much larger than the relatively slender ankles and wrists. This visual cue is a critical indicator for diagnosis. The fat itself has a different texture, often described as soft, dimpled, or nodular. Pain is a very common and often debilitating complaint for individuals with lipedema. This pain can range from a dull tenderness to a deep, aching sensation. It is frequently exacerbated by palpation or even light pressure on the affected areas. The fat tissue itself is often hypersensitive to touch. Bruising easily is another common symptom, even from minor bumps or pressure. Many patients report a persistent feeling of heaviness in their limbs, which can significantly impact mobility and daily activities. Fatigue is also a prevalent symptom, contributing to a reduced quality of life. The swelling associated with lipedema tends to worsen throughout the day. Prolonged standing can also exacerbate this swelling and discomfort. These symptoms are not typical of simple obesity and point towards an underlying medical condition. The exact underlying cause of lipedema is not yet fully understood. However, it is strongly believed to be linked to hormonal factors, particularly estrogen. The condition often appears or significantly worsens during periods of major hormonal shifts in a woman's life. These critical periods include puberty, pregnancy, and menopause. This strong correlation with hormonal changes highlights the systemic nature of the disease. Genetics also play a significant role in the development of lipedema. A strong family history of the condition is often present, suggesting a hereditary component. Research continues to explore the specific genetic markers and hormonal pathways involved. Understanding these factors is key to developing more targeted treatments. Diagnosing lipedema involves a comprehensive approach, beginning with a thorough physical examination. A detailed medical history is also crucial, including questions about symptom onset, progression, and family history. The assessment focuses on the characteristic fat distribution. Medical professionals will look for the disproportionate fat accumulation and the symmetrical involvement of the limbs. They will also assess the presence and severity of pain and tenderness in the affected areas. The absence of swelling in the feet and hands, creating the cuffing effect, is a key diagnostic sign. In some cases, imaging techniques may be used to aid in diagnosis. Ultrasound or MRI scans can help visualize the fat tissue and rule out other conditions. These imaging studies can also confirm the diagnosis by showing the specific characteristics of lipedema fat. Currently, there is no known cure for lipedema. However, various treatments are available to help manage symptoms and slow the progression of the condition. The primary goal of treatment is to improve quality of life and prevent further complications. Conservative treatments are often the first line of defense. Compression garments are essential. They help reduce swelling, improve circulation, and provide support to the affected tissues. Manual lymphatic drainage, or MLD, is a specialized massage technique that stimulates lymphatic flow and can help reduce fluid buildup. Regular, low-impact exercise, such as swimming or walking, is also highly beneficial. These activities can improve circulation, maintain mobility, and support overall health without putting excessive strain on the affected limbs. Exercise helps manage weight and can reduce inflammation. For some individuals, surgical intervention may be considered. Tumescent liposuction, performed by a surgeon experienced in lipedema, is a specialized procedure. This type of liposuction aims to remove the excess diseased fat and alleviate symptoms. It is not a cosmetic procedure but a medical one. Liposuction can significantly reduce the volume of affected tissue, decrease pain, and improve mobility. It is typically considered when conservative treatments are no longer sufficient to manage the condition effectively. Post-surgical care, including compression and MLD, remains crucial for optimal outcomes. Early intervention is absolutely crucial for effectively managing lipedema. Diagnosing the condition in its earlier stages can significantly improve a patient's quality of life. It allows for the implementation of management strategies before the condition progresses to more advanced stages. Early treatment can help prevent the condition from worsening, reducing the severity of symptoms and potential complications. It empowers individuals to take control of their health journey. Seeking an early diagnosis enables patients to advocate for their needs within the healthcare system. It also allows them to access necessary support and treatment options sooner. Understanding lipedema is the first step towards effective management and a better future for those affected. Awareness and education are key to ensuring more people receive timely and appropriate care.